and he was given antibiotics. So this gentleman was given antibiotics, okay, and after he took the antibiotics, he started with pain in the anal region. He also has a small swelling in the anal region, and he has frequent urging for stools. So this is a small case, and I just want your inputs. I don't want the medicine. You are a second year student. Expecting a remedy from you is too much, but at least what exactly you expect or what exactly you understand in this case. So there's a problem. Somebody says voice is breaking. So if I'm clear, 35-year-old man comes to me with pain in the anal region, and he also has a swelling done, and this started typically after taking antibiotics, and he also has frequent urging for stools. So this is how the case was presented to me. See, two things that you understand or you get from this case is, before antibiotics, he was absolutely fine. He did not have any rectal complaints. So the complaints started after antibiotics. Okay. So the remedy that we'll be discussing today is a remedy which has ailments from or which has complaints from any allopathic medicines, not necessarily antibiotics. It could be any allopathic medicines. Fine. So with this, what we also have to understand here is, I'll just show you a small image. This you would have seen in your pharmacy class. Okay, if you're not very sure about this image, at least this image will definitely tell you the remedy that I'm going to speak today. So, what according to you is the remedy that we are going to discuss today? From the images, I also gave you a small case. We'll discuss about the case as the class progresses. But to start with, a remedy which you have seen in your pharmacy, see, you need to be a little quick, type or unmute and answer. Otherwise, without interaction, the class becomes boring. Though it is online, though it is distant, we'll try to have as much as interaction as possible so that both of us equally enjoy the class. Okay, so what is this? What is this? Now, what is this image that I've tried to show you? So somebody says, sir, the allopathic medicines have disturbed. You can't see the PPT. PPT is not visible.
Nakswamika, sir.
Very good, beautiful. The remedy we'll be discussing today in detail is Nakswamika. See, Nakswamika is a remedy, which is very, very important as a homeopath. And you'll understand why Nakswamika is so important and why are we giving so much of importance to Nakswamika. As a practitioner, I use this particular remedy very often in clinic. And as a student, it's very important you understand Nakswamika so that you can apply this knowledge in your future practice. So Nakswamika is what we are discussing. As you see here, we don't use the entire plant. We just use the seeds because seeds are the major uh, poisonous substance. The majority of the alkaloids of Nakswamika, they are present in the seeds. So we take the seeds and we use it homeopathically. So a little about Nakswamika. The common name of Nakswamika is poison net, and Loganaceae is the natural order to which Nakswamika belongs to. See, as a second year student, natural order may not be of great importance, but as you go to third year and final year, you realize a remedy which belongs to a particular group, particular order will have something in common. So many of the Loganaceae remedies might have some common thread. Okay, though it is not important for a second year student, but you should know the relevance of the family. Okay, so Nakswamika belongs to Loganaceae, and two very important alkaloids you have in Nakswamika. One is strychnine, the other very important alkaloid you have is brucin. So majority of the pathogenesis in Nakswamika, they are because of presence of strychnine and brucin. Now, how do we prepare? This entire slide is dedicated to the pharmacy part, okay? And it is prepared by the process of trituration, which you have all done in your first year. Now, what are the aims and objectives for today's class? What exactly I am going to do in the next 40 minutes? So, at the end of the session, the learner shall be able to list the sphere of action of Nakswamika, list the pathogenesis of Nakswamika. See, sphere of action and pathogenesis, they are two very different terms. You will realize as I go further into the class. The second objective for today will be like we will try to list the ailments of Nakswamika, okay, and we'll also have another last objective here. What we'll try to do is we will try to enumerate the characteristic symptoms of Nakswamika. So three basic objectives we have for today's class. Please concentrate, a very important remedy. Okay, so starting with the first objective, or before we take up the first objective, what we also have to understand under the introduction of Nakswamika, like we saw in Dulcamara grows in soil which is rich in moisture. So similarly, what you see is where exactly Nakswamika grows, or where do you find Nakswamika? Majorly, you see Nakswamika in the Asian countries like India, China. These are the areas where you see Nakswamika growing. And the credit for proving Nakswamika goes to this great man, Dr. Hanuman. He was the prover who proved Nakswamika. Going ahead, now this is very important. From here onwards, whatever I am going to speak, each point is very important. Now, what is this I am trying to highlight here is when a triturated Nakswamika is taken. Now what we say is, or what we call this from your pharmacy knowledge, which again you'll be studying in your organon, I'm trying to tell you about drug proving. So when Nakswamika is taken, the person comes with a set of symptoms. That is what we'll be studying in next few minutes, or how many of our classes we take. So whatever the information I'm trying to give you here, that information has come from drug proving. And Nakswamika as a remedy, before Hanuman introduced into homeopathy, it was widely used by allopers, by ancient people. So that knowledge also will become important for us. And the accidental proving of Nakswamika. Accidentally somebody takes Nakswamika, or the poisonous effects of Nakswamika. That is the toxicological provings of Nakswamika. And more important is the clinical observation of the physician. All these things, they become very important. Now whatever I'm going to talk for next 40 minutes will be a combination of all these things. Nakswamika that we have got from drug proving, Nakswamika that we have got from poisoning, Nakswamika that we have got from accidental proving, and Nakswamika, the symptoms of Nakswamika that we have got from the clinical observations. Okay, so what is the sphere of action? So when Nakswamika is taken, which part of our body Nakswamika affects? So that becomes the very important thing. Like that becomes the sphere of action of Nakswamika. Okay, so to start with, the first sphere of action of Nakswamika is, see, now to understand the sphere of action, you need to have two very important subjects knowledge. The basic physiology and the basic anatomy, they play a very important role in understanding the sphere of action and pathogenesis. To understand pathogenesis better, you should also have a very good knowledge of pathology. Okay, so unless you understand the allied subjects, materia medica will become boring. If we apply the knowledge of allied subjects, materia medica will become interesting. Okay, so to start with, Nakswamika acts on the nervous system, very important. And next, you also see this acting on the eye. You have the picture there. You see this acting on the nose. You see this acting on the ears, the GI, the stomach, the liver. Of course, the intestines, very important. Okay. And you also see Nakswamika acting on the urogenitalia, the urinary tract, the bladder, the lungs, the respiratory tract, the male genitalia, the female genitalia. See, if you look at the slide, what you are seeing is Nux is a remedy which has a capacity to act on the various systems and various parts of your body. Now, such remedies are the remedies that we call it as a polychrest remedy. A remedy which has a wide action and which is used for wide clinical applications. Such remedies are called as polychrest remedies. And that's the reason why we are giving so much of importance to Nakswamika, because as a practitioner, as I told you, we use it day in and day out. And as a student, you know, it is a polychrest remedy and you should have a clear understanding of Nakswamika. Now, this is the sphere of action of Nakswamika. Now, a question should come to your mind, acting on nervous system, what will Nakswamika do? Or acting on the male genitalia or the stomach, what is the action of Nakswamika? Now, this is what we call it as this pathogenesis. This is what we call it as pathogenesis. Fine. So, in the next slide, we'll try to explore the action of Nakswamika on all these organs one by one. I hope I'm clear. Sphere of action, and then we are talking of the pathogenesis. Now, what is the pathogenesis? Individually, we'll see. Now, acting on the nervous system, what will Nakswamika do? To make things very simple, I have classified, or I have taken from books wherein Nux basically acts on two very important areas: the motor and the sensory nerves. So Nakswamika acting on the CNS specifically. See, in general, the nervous system and in particular the motor and the sensory nerves, and acting on the motor nerves, Nux is a very good remedy for paralysis. Okay, so tomorrow we also spoke of a remedy, dull camera, in the last class. Dull camera also was indicated for paralysis. Now, dull paralysis was something different. We saw paralysis of single parts and the affected part being IC code. We'll also try to explore a little later what is that characteristic paralysis you will have in Nakswamika. For time being, acting on the motor nerves, Nux causes paralysis. What is its action on the sensory nerves? Acting on the sensory nerves, Nakswamika will cause oversensitiveness. See, these points are very, very important. Please retain all these things, not only for your theory or your viva, for your life. They are very important. So, motor nerve, sensory nerves. Okay. See, and this is, if you understand pathogenesis, particulars become very easy tomorrow, and you can explain why there is oversensitivity. For example, now you see the eyes. Eye is, eye vision. Now, what will happen here is, acting on the eye, what Nakswamika does is it will cause hypersensitivity to vision. Meaning, a Nakswamika patient cannot bear light. Tomorrow, you have a patient coming to your clinic the same way, and he says, "Sir, too much of light, I can't bear light." Okay? Or at home, he's sitting in a dark room. Now, if he is a patient of Nakswamika, this happens in Nakswamika because Nakswamika acts on the sensory nerves and it will cause oversensitivity. Same light, many of you are there, you don't feel that sensitive. But this is Nakswamika, this is homeopathy, this is individualization. Same light, Nux feels, there's too much of light. So hypersensitiveness to light is what you see in the eyes. Similarly, you can start, contributing now. What will happen on the ears? Fine. Here, eyes, you saw that they're very sensitive to light. Now, what is the physiological, what is the function of ear? Ear function is it helps in hearing. Fine. So, here, small noise for Nakswamika might be a big noise. So, Nakswamika husband, when he comes back from office at home, kids are watching TV or a radio is on. he might feel that it's too much of a noise. He might start yelling at them, reduce the TV volume, reduce the radio volume. So sensitiveness to noise is also what you find in Nakswamika. These are all very important. And nose, you know what happens in the nose. I'm talking to you about the sense organs. Nose, they're very sensitive to smell. Somewhere something is cooking, or somewhere some bad smell. Nux will be the first person who can pick up smell. So tomorrow you have a group of friends, and one friend says, "Boss, I'm smelling something bad." And after some time, you people realize, yes, there is the smell coming up. He could be Nakswamika. There are many remedies. Nux is one of the remedies. Okay. So sensitiveness to smell, the sense of smell will be increased in Nakswamika. Same applies to the tongue. Taste. They're very sensitive to taste. For example, sweet, kara, spicy. They can feel it fast. They can feel it more. The last sense organ that we'll be discussing here is skin. Now, what happens in skin? In Nakswamika, the skin is very, very sensitive. For example, if you touch, right, they feel sensitive. Sensitiveness to touch is a very important point you have in Nakswamika. So sphere of action, and I'm talking to you about pathogenesis. We just saw what Nakswamika does on the nerves. We saw its action on the sense organs. Now, this is a very central area where Nakswamika affects. And you see this area, and this is the JAT or the stomach in particular. There are many remedies in our materia medica which act on the JAT. Nux is one remedy that stands out. As a second year student, you can recall other remedies. Okay, so this being what is it? Online class. If you can just take some time and quickly type what are all the other remedies that you can think of which has action on the JAT. If you're quick, it will be fine because we have 40 minutes time and it's very important that we continue with the class. So what are all the common remedies that you can think of as a second year student? You have a remedy like aloes. Good. See, aloes, more than the stomach, it will be the lower intestines. Okay. You also have remedies like antimonium crudum. Don't forget antimonium crudum, a very important remedy acting on the JAT. Fine. So we'll come back to the action of Nakswamika on stomach. As you see the image, the icon here, Nux will have increased appetite. Nux can have inflammation, gastritis, beautiful remedy. Many homeopaths blindly prescribe Nakswamika, which is wrong. Nux has its own indications. You should learn the art. So, Nux on the stomach causes gastritis, and it also is a very good remedy for vomiting. So, three things that you should remember. One is increased appetite, second thing is inflammation, and third thing is vomiting. Not only the stomach.
Sir, excuse me.
Yes.
Hello. Sir, excuse me.
Not only the stomach.
Uh,
Yeah, there are few students who contributed.
sir,
Remedies acting on
video doctor.
Syncona, very good. Pulsatilla, good. Colosynth, yes. See, but colosynth is more for the colic. Fine. Or any gastric complaints which comes from insult, which comes from suppressed anger. Gastric complaints, for example, vomiting, for example, colic, which comes from he being insulted or he not able to show anger, then you can think of colosynth. Okay. So I'll continue with liver. Again, liver is one very important organ, which you know from your knowledge of anatomy and this thing. What is it? Physiology. So one of your friend wants to know, when do you think of carbo-veg? Yes, nice question. When do you think of carbo-veg? See, carbo-veg is again a remedy which has sphere of action on the J. Now, what I want to highlight here, I can't go into the depth because main focus is Nux. But having raised this question, see, carbo-veg is also a remedy which will have problems with digestion. The digestion gets weakened. The digestive system is weak. The digestion process, the physiology in carbo-veg slows down. So you see more of heaviness, you see more of burping, more of nausea, more of vomiting that comes up in carbovage. Okay, so that's about carbovage. We'll quickly get back to Nux Vomica, and we will see that this is a remedy which has main action on the liver, and acting on the liver, you see this causing a few problems. It could be as simple as inflammation, hepatitis, or you can also see liver getting enlarged, hepatomegaly. We'll discuss more in detail. Portal congestion, very important. Hepatitis, portal congestion. Now, why again liver gets affected is an interesting thing. We have a beautiful explanation. You'll have to wait a little so that when the time is right, I'll talk to you about this area. Not only liver, one more area, that is the GIT. The entire GIT using Nakswamika acting, the large intestine, the small intestine. Specifically in the large intestine, the last part, like the the rectum, the anal canal, you see Nakswamika acting. And from the icon here, you see two things happening in Nakswamika. Many things can happen. There can be diarrhea, there can be dysentery, but I am concentrating on two areas here. One is constipation, and the other is hemorrhoids, or what we commonly call it as piles. Okay, so this is with GAT. The other area is the urinary tract. Nux, from the practice, we have seen a very important remedy for kidney stones. More than stones, I would like to focus on this area, the bladder. And what happens in Nux Vomica is acting on bladder, it can cause incontinence. Now, why incontinence happens in Nux Vomica? Okay, we'll have to again go back to the action of the first action of Nux Vomica, that is the nervous system. So the nerves which control the bladder, they go weak, and the bladder loses control over the urine. It's a sac which holds urine. So the nervous phenomena that gets affected, and you see urine dribbling, or there is incontinence of urine in Nux Vomica. Plenty of remedies. Nux is one remedy I want you to remember. Male genitalia. Okay. Nux, as you understand Nux Vomica, you will realize Nux is a remedy who has a lot of energy. Okay. Very enthusiastic guy, lot of energy. So initially what you see Nux Vomica acting on the male genitalia, it increases sexual desire. If you just see this icon, it increases sexual desire. But you'll also see Nux Vomica, the next objective will be talking ailments from. Nux will be too much stressed, he is into too much of alcoholism, etc. etc. And in the later stages, what increased sexual desire he had, it goes down. It goes into an opposite state where he becomes completely impotent. So initially sexual desire increases, and slowly the sexual desire comes down on the male genitalia. On the female genitalia, this mainly causes a lot of menstrual irregularities. There are a lot of other areas. You have dysmenorrhea, you have labor affections. We'll explore a little later. I would like to highlight something here. Nux, we always talk of this being predominantly a male remedy. But mind you, Nux also has good action on the female genitalia. Okay. The last area is the respiratory tract. On the respiratory tract, the upper and the lower, what you see in Nux Vomica is upper you see coryza, cold happening. Lower respiratory tract, which is my main focus here, is Nux is a very important remedy for gastric asthma. I'll talk more in detail when I tell you about the respiratory affections of Nux Vomica. A small recap, what we did is we just introduced you to a remedy, Nux Vomica, a plant, seed is what we use, and then we saw that Nux is a polychrest remedy. This being a polychrest remedy, it has action on various parts. Any part you name in Nux Vomica, you see Nux Vomica, I mean any part you name in your body, you see Nux Vomica acting. Okay, starting from head to toe. Okay, any questions at this stage? If you have any questions, quickly you can. Yeah, somebody was talking of anal fissure. Yes, absolutely right. It can be a remedy for anal fissure, hemorrhoids, like dysentery. I was talking of constipation, diarrhea, lot of things. See, this is just a gist. In detail, we'll be taking under particular symptoms. Okay, I hope I'm clear. Any quick questions if you have at this stage? Because I want this to be very clear, very important remedy. Every remedy we speak is important. So is this beautiful remedy, Nux Vomica. Okay. Any questions or we'll move further? No questions. Beautiful. Okay. So if you have no questions, then the second objective of today, we were trying to talk of a second very important objective. And what is that in Nux Vomica? Ailments from. What are the causative factors of Nux Vomica? Here, I'll go back to the case that I tried to discuss. I told you about a man who develops hemorrhoids, who develops frequent urging for stools, and all this happened after he started taking antibiotics and after he started taking painkillers. So, in this case, what will be the ailments from? Ailments from allopathic drugs. Okay. So, any problem a person comes to you with, what was the cause for the problem is ailments from. And you know, each of our homeopathic remedies, they have their own set of causative factors. So next few slides, we'll try to explore what are those ailments from in Nakswamika. To start with, just see the images. Yes, somebody writes alcohol, beautiful, I agree. Just see the images and a picture, they say there's a proverb, a picture speaks 100 words, something like that. But what I want you to understand is, every image that I've taken here, that I'm trying to show you, has some meaning, has some thought behind me taking in those images. So I want you to sync with those thoughts of mine so that you understand this particular remedy better. So what you have in Nakswamika here is, Nakswamika is one remedy which has ailments from sedentary habits. If you just see here, he is a office going man and he is sitting. Like for example, many of our IT professionals are people who do desk job, clerks, typists, many of the administrative officers. They have to sit for many hours looking into the files are looking doing some job, stressful job. So first ailment of Nakswamika is, yes, they're business oriented, there is a lot of stress, beautiful. I agree with all what you're trying to contribute. So sedentary habits will be my first ailments from Nakswamika. See, he is a man who is stressed, who is emotionally stressed. So when you are so much stressed, what gets affected is your sleep. Okay, it's been 3 a.m. and is not able to sleep. So loss of sleep becomes the second ailment from. So first is what sedentary habit, second is loss of sleep. Many of you were typing alcohol, alcohol. Yes, alcohol is also a causative factor in Nakswamika. Not only alcohol, Nux is a guy. See, I want you to typically understand a man who is stressed, a man who is overworked, and to keep him going, right? Like somebody just now typed, to keep him going, he needs some stimulants. Okay, he's overworked. So what he does is he orders a cup of coffee or he takes two puffs of cigarette and then he feels a little regenerated and he feels he can focus better on work. So stimulants like you see, for example, alcohol stimulates, cigarette gives them a kick, coffee is a stimulant, tea is a stimulant, fine. And in the bargain, what you also see Nakswamika doing, this is an image I want you to remember. They tend to overeat. Okay, they tend to overeat, and unfortunately, what Nakswamika eats is all the junk food, the fast food, which will affect his liver. See, now you please try to reconnect to the liver. Now, the alcohol, the loss of sleep, the overeating, the coffee, the stimulants, from your knowledge of physiology, from your knowledge of pathology, they all will have an adverse effect on the liver. That's how liver gets damaged in Nakswamika. Okay, that's how we'll have gastritis. Alcohol can cause gastritis. Overeating can cause GI affections. Coffee can cause gastritis. You're getting my point? This is how you should start linking. Why? See, any ailment and any sphere of action, they're all beautifully linked. That's something great about homeopathy. They're all beautifully linked. And if you understand this, then nobody can stop you. Meaning, if you understand and if you fall in love with this beautiful science, homeopathy, it will be a great thing. Anyway, see another very important thing, again to do with liver, allopathic drugs. Mind you, this is one remedy. We have some 18 to 20 in our materia medica, but the first remedy that comes to any homeopath's mind is Nakswamika for bad effects of allopathic drugs. Sexual excess, okay? And this image, what I'm trying to show you here is high living. Nux is a person who is into alcoholism, who is into stimulants, who likes that partying life, who likes that high life, high funda life. When partying, is into drugs, is into alcohol, alcoholism, is into a lot of things. So high living is a word that we use in Nakswamika, people who are into all these things. And another very important ailment is spicy food. These were all the physical elements that we saw. On the emotional level. Anger, very angry guy, Nux. Anger can cause problems. Not only anger, sadness. We will see when we take up Mentos, what triggers anger in Nakswamika, why Nakswamika goes into sadness. It's a beautiful class. Probably next class we'll talk of mind of Nakswamika. It will be very, very interesting. So this image tells you about the next personality. He is overworked, he is overstressed. You see him doing multitasking. There is a time constraint. By this time, he's got some targets. By this time, I need to finish this. Before this, I need to do this. So he will have a lot of targets. So getting overworked, getting mentally stressed, there are few problems which can affect in Nakswamika. Getting chilled, for example, we also had this in dull camera, getting chilled. Fine. So these are all few causative factors of Nux. I hope this is clear. Uh, Sphere of action, pathogenesis, ailments from. The next thing, again, if you look at the image here, what you see is there are some 6 things here that are shown, 7 things here that are shown. Only one is different. So my focus here is the characteristic symptoms of Nakswamika. Nux has thousands of symptoms. Out of those thousands of symptoms, what is it that is characteristic is what we are trying to take up in the next class. See, to start with, the first characteristic symptom of Nakswamika is, I told you this is a remedy which acts on nerves, the sensory nerves, and acting on the sensory nerves, I told you it will cause oversensitiveness. Okay, so the first characteristic symptom is on the sensory organs, you need see Nakswamika causing oversensitiveness. So to touch, to noise, to light, to taste, to hearing, they're very, very sensitive. So this is something that should come to your mind. And in practice, we see an Nakswamika, especially in acute complaints, like he cannot bear noise, he cannot bear light. They want to be in dark room or they just shut their eyes, fine, and is very irritable. So this is a typical picture of Nakswamika, which I want you to remember. Second thing here, what I'm trying to show you here is Nux, again, its affinity for nerves is a very good remedy for convulsions. Okay, see convulsions, you got hundreds of remedies in our materia medica. Now, what is the PQRS of Nakswamika? Where is Nakswamika indicated in a case of convulsions? See, now what I want you to remember here is in Nakswamika there will be convulsions with consciousness. Meaning, you have seen this in movies, somebody will have a fit and then the heroine is, she gets up somewhere and she asks, "Main kahan hu, kya hua," etc., etc. Meaning, she was not aware of what happened. So that is convulsions with unconsciousness, which is common. But in Nakswamika, when the conversion is happening, he is aware of the entire thing, whatever is happening there. So he is conscious. This becomes characteristic. I hope I'm clear. Okay. So the third thing here is see the image and you try to at least guess what could be the characteristic symptom. I could have asked, but now because of the time, we can't make this too much of interactive. session, but yes, at least I want you to think. Yes, sir has shown an image where somebody is keeping hand over his abdomen. So what I want you to realize here is this is a symptom in Nakswamika. 1 to 2 hours after eating, okay, they feel a sensation of stone heaviness. How heavy is it? In the patient's language, he will tell you, doctor, I feel as if a stone is there in my abdomen. When do you feel that? I feel this 1 to 2 hours after eating. Okay, it's a subjective symptom. There will be no stone. It's a sensation. So that's the third characteristic symptom. Fourth thing, on the rectum, we have very, very important thing here in Nakswamika. See, that case I discussed with you is a case where a person would go to stool very often, but he would not, he will have an urge, but stools will not happen. Or even if he gets stools, it will be small quantity. Again, he'll come back and again he feels, I have not completely evacuated. So, unsatisfactory stools, frequent urging for stools is very characteristic in Nakswamika. Okay, must be as an assignment. You can take it and you can let me know why this ineffectual urge happens in Nakswamika. When we meet next week, you please hunt for this and you get back. Okay, why there is ineffectual urging in Nakswamika. Okay, so after this, fever. Nux is a remedy which is indicated in intermittent fever. Okay, so in intermittent fever, you all know that there will be chills, there will be heat, and there will be sweating. Now, why I have put Nux Vomica under PQRS here is that in fever, Nux, you'll have to imagine, you'll have to understand, Nux wants to cover in all three stages. Okay, so we will go step by step. When you feel cold, what do? Yes, you need covering. When you start feeling heat, what do? You kick away the covering. You don't want the covering. And when you start sweating, you don't need the covering. This is typically what happens in any intermittent fever. But in Nakswamika, whether it be chills, whether there be heat, or whether it is chills, I mean whether it is sweating, all the three stages, Nux wants to cover himself. This is very characteristic. Tomorrow you get a case where, sir, even during heat, even during sweating, I feel like covering. You'll have to remember Nakswamika. Very important. Okay. So apart from this, what exactly Nakswamika likes to eat? What we call it as the desires, or a little higher, the cravings. From the ailments, from that Nux is a guy who loves stimulants. So coffee, tea, cigarettes, alcohol, non-veg, spicy, highly seasoned food, okay, is all what Nakswamika enjoys. And what Nakswamika does not like. See, Nux does not like two very important things. One is bread. The other thing Nakswamika does not like is water. Okay, is water. Does not like even water. Okay, so apart from that, what you also have is Nux. I told you, like, when we started discussing, I told you that Nux is a remedy which is, though predominantly male remedy, it is also indicated in female complaints. So labor pains of Nux vomica, they are very, very characteristic. Okay. So what is that? That is characteristic. Nux is very sensitive to pain. So the labor pains in Nux vomica are very violent, very spasmodic, and during labor pains, a lady will have a frequent urge to pass stools or to urinate. This is very important. More we'll discuss under the female symptoms of Nux vomica. Okay. So now the last characteristic symptom I want to tell you here is Nux is again a very good remedy for fainting. People who just go unconscious, who faint. Now, each remedy can faint because of various reasons. Why Nakswamika faints? What triggers fainting in Nakswamika? Light, smell. I told you they're sensitive to pain. When they're in pain, they can faint. When they don't sleep, loss of sleep can trigger fainting. Loss of fluids, for example, bleeding, diarrhea, vomiting, all these things. From your knowledge of pathology, there will be hypovolemic shock and a person can faint. So Nux can faint from these particular causes. To sum up, the three objectives that we had planned for today, one was sphere of action and pathogenesis, the second was ailments from, and the third was characteristic symptoms. Okay, I hope I've done justice to today's class. We have a minute's time. See, in the next class, we'll try to explore the mind. I might take 40 minutes. It's a beautiful topic. Please do attend. Now, before we close for today, if you have any quick doubts, I'll be happy to take up the doubts. Uh, okay, you have any doubts? One person has already answered why there is ineffectual urging. Very good. One by name Deepika, very good. See, now what happens is again the knowledge of physiology. Now the bowel movements requires the peristaltic action. In Nakswamika, there is improper peristaltic action. Okay, so what will happen is the peristaltic movement will not be complete. It will be an incomplete peristaltic movement. This act will give rise to an ineffectual urging for stool. Beautiful, good. One Deepika. The exactly opposite will happen in a remedy. There, they will have absolutely no urge. It's been 2 days, doctor, I have not passed motions. It's been 3 days, doctor, I have not passed motions. But they don't feel like passing motions. Okay, and that is bryonia. When there is absolute lack of action of the peristaltic movement, the remedy will be bryonia. Here there is action of peristaltic movement, but the peristaltic movement will not be a complete movement. So it will be incomplete peristaltic movement. Very good. She made your job easy. She had answered the question. Good. So please go through whatever I have tried to tell you in the next class. And please do read Mind of Nakswamika from Kent's. Okay. So that when I start teaching you, you will understand and you will feel Nakswamika in a better way. Thank you all.